This is Scott, this is Yvonne, and this is Amanda. They have struggled with smoking in addition to other behavioral health challenges.
I know a lot of people who started smoking because they went to a mental health or addiction facility that encourage, kind of schedules around smoking.
I think they should encourage them to not smoke.
When I was 29, I went to treatment for alcohol and drug. And that is where they had smoke breaks, about 6 to 8 a day. And so kind of like to be part of the crowd or to socialize with the women there, you would go outside and smoke.
Did their behavioral health provider address smoking?
No, it wasn't actually addressed for by my treatment.
I also had therapists and doctors telling me, why are you going to quit smoking? Because, you've already given up drugs, alcohol. So what would be, it's okay, the smoking right now, don't worry about it too much. And, they kind of promoted it a little bit.
It was just the psychiatrist that said, as long as you're seeing a benefit from it. But there was so much not benefits. I'm a vocal music major, and it destroyed my throat.
Well, I did notice that once I started getting on a proper medication, that it seemed like the cigarettes were not satisfying me as much.
I wish that I had gone to a program that was non-smoking to begin with so that I would have never started smoking.
I think I'm doing better without the nicotine, and I don't ever want to go back to doing it because it's so many things against having smoking than positives about it.
It was 2014 that I quit. Setni Mai, the 17th of May. I'm Norwegian, and it's Norwegian Independence Day, and it's my nicotine Independence Day.
I could tell too, I guess as the years went on with smoking, that it was harder and harder to breathe.
That just really started to scare me. So this last time I thought I'm going to be extra cautious, and I used the Chantix, and I am so grateful for that. I couldn't believe how much it helped me to be able to take away that need to go and have it, and because I just was so afraid I wouldn't be able to make it again.
I was a smoker for probably about 14 years, and I've been a no smoker for 5 years now.
I know I can't always be in control, but I need to control what I can. And that's a real lesson that's difficult for people with mental health challenges because we feel so out of control and that we have no control. And I kept telling myself, this is something I do have control of. Though the last time I quit, I knew I couldn't do it by myself. I knew I definitely needed help. I would not be able to do it. And so I went through a clinic, a free clinic, and they gave me the Chantix with visits every week.
I used to change the channel when those commercials would come on about people smoking because I didn't want to see that because I didn't want that reality for myself. So I think also just watching some of those things, hearing some of those things can have a pretty strong impact.
Tried using the patches and the gum, and one thing that helped me was looking at YouTube videos on YouTube about people who are quitting or telling about the benefits of quitting.
I'd always been an athlete, running, and those things were really important to me. So I wanted to be able to get back and do those things.
And I actually received an award for hiking the Ice Age Trail section of it.
Really? Good for you.
That was something that me and my sister did as a hobby, is we hiked a section at a time with our we take 2 cars and hike a section at a time until we did the whole length of Washington County.
Wow.
And that was after I had quit smoking. It's like a cycle that goes on and on. You smoke and then you feel bad. So what you have to do is kind of break that cycle.
I thought I was smoking to relieve the stress, but it was really intensifying it.
Making the stress worse.
Because having the money to get it, and then it closes the capillaries, and so you're not getting the blood, and you're not functioning as well. And so it's physical as well as the mental.
I was a lot stronger than I thought I was, because I always thought, oh my gosh, I'm never going to be able to quit.
I would say, you don't really need to have cigarettes, and you can live without them, and try to see how long you can go without smoking, and keep trying and trying until you finally quit. And if it happened to me, it could happen to you.
You can do it, because we've been told we can't for so many things. I mean, long ago, you can't have a family, you can't go to school, you'll never have a job, and all of these can'ts, lay heavy on us, even though recovery is possible for anyone. It's living a happy, fulfilling life up to your own potential. And I think people need to know, no matter what they're challenged with, that they can do it.
If it's a desire that someone has to want to quit, you definitely can get there. Because I didn't think I would ever, I wanted to, but I didn't think it was possible.
One cigarette is all it takes to get right back on the thing. So it's like, okay, I'm going to maybe be committed now to never smoke again, and it's been working for 5 years now for me.
What I try to give other people is let them know I believe in them, because sometimes we can't believe, and someone needs to believe for us. And so it's really important to me that we really believe we can recover, we can quit smoking, we can live a happy, productive life.
There's hope, yeah. There are people that can help.